Lots and lots of people excited to work together in order to ensure that all Coloradans have affordable health insurance. So thank you all. I'm Annie Warhover. I'm the president and CEO of the Colorado Health Foundation. And on behalf of our partners in this event, the Division of Insurance, Connect for Health Colorado, and the Department of Healthcare Policy and Financing, I welcome you to the very first Building Better Health Enroll 2015 event. Thank you all for being here. We in Colorado are so incredibly fortunate to have partners working towards a common goal. And that common goal is that all Coloradans achieve stable, affordable, and adequate health coverage by 2023. This event is a reflection of that goal, but it is also a chance for us to express our gratitude for your incredibly hard work and commitment to getting Coloradans covered. You guys are in the trenches where the rubber meets the road, and we thank you so much for your hard work. This room represents hundreds. I think there's around 700 or so of you having lunch together. Your health coverage guides, your assistant site navigators, certified application counselors, brokers, agents, community-based organizations, health advocates, health plans, and healthcare providers. Because of you, more than 310,000 Coloradans gained access to health care through health coverage in the first open enrollment period. Because of you, 310,000. Because of you made Colorado a leader among states with their own exchanges. We exceeded the CMS identified state target of 92,000 enrollments by more than 30%. As we work toward the next open enrollment period, which is exactly 1 month and 1 day from today, we hope this conference supports and inspires you for the work ahead. We have 3 goals for this conference: that you receive the information, the training, and the resources you need to be successful in your job, that you have a chance to network with your colleagues, meet somebody new, because these relationships will be critical to your success in the upcoming months. And finally, I can't emphasize enough the importance of your story. The storytelling theme of this conference is very intentional. You do great work, and everybody should hear about it. When you share your passion for your work, you raise awareness of the importance of health coverage for gaining access to health care. We've provided you an opportunity to tell your stories. There's video booths outside of this room, and we really would encourage you to stop by over the next day and a half and tell your story. I was telling a group earlier that the stories are inspiring to all of us. We love to read about them. And for those people who aren't sure whether the Affordable Care Act is a great idea, these stories are really, really important. They resonate with people. So please, you've got the stories. Please take the time to tell them.
Good.
Okay, so we're both wearing black pants. I'm sure
Mike's
that's a
wrong.
good sign.
Hello again. I hope you all enjoyed your lunch and your conversation. We're ready to start our panel discussion, and I'd like to welcome Cynthia Hessin. You probably recognize Cynthia, as she is an award-winning journalist and host of the Rocky Mountain PBS Colorado State of Mind. Welcome, Cynthia.
Thank you, Annie. And thank all of you. As I understand it, you are the people who have taken on all the complication of this new system and figured it out and are living to tell the tale. So I don't know if it's more overwhelming than I imagine or less overwhelming, but you have to be some of the biggest, your brain cells must just be churning, because you know what they say about taking on something that's complicated. So it is great to welcome all of you and to have this conversation now where we can come to understand a little bit more about what's going on with some of the top people in the state that you would like to hear from. So Annie Warhover, as you know, is president and CEO of the Colorado Health Foundation. And then in Camel today, Sue Birch, who is executive director of the Colorado Department of Healthcare Policy and Financing. She's on Governor Hickenlooper's cabinet. Gary Drew's here in gray. I'm just saying gray because instead of saying he's the man on the panel, he's the interim CEO for Connect for Colorado. And on the opposite end from me, Marguerite Salazar, who is Colorado Insurance Commissioner, Department of Regulatory Agencies, Division of Insurance. All of them with big jobs too. So welcome to everyone. So as Annie mentioned in her introduction, Colorado has covered about 310,000 people by now. As a leading state, and I'll ask Sue to take this first, what are some of the outcomes and challenges that you are seeing from having more Coloradans enroll?
Well, I want to start by telling you all how amazing it is to see this sea full of people here around this culture of coverage challenge that we've got. So 4 years ago, Cynthia, the state really moved to say, hey, coverage is really, really important, and we got to get educated, we got to get everybody on board, and oh my God, have you guys delivered. So the opportunity has been amazing, using technology, using our stakeholder relationships with all of you, using kind of Colorado's health and wellness momentum. We have found lots of people, as everybody knows. And you know, there's going to be ongoing challenges because this is complicated stuff. I mean, getting people to understand what being insured means, how to be new consumers, getting people to understand that this is something they're going to have to start doing every year and reporting their changes and really buying into their health and wellness is going to be an ongoing challenge. But we're up for it with all of you, and we're really pleased with how things are going. And you know, we'll keep tweaking our technology advances and keep educating and reaching out and continuing to host summits. And all those things are going to really push our state forward, really propel us into finding each and every Coloradan that needs to get covered.
So it's primarily a matter of education for people and so forth. How about impact on the system? Is there anything we can say about that?
Well, our new version 2 of our peak system is about to unveil, and I'm really pleased that Gary Drew's our partner over at Connect for Health. Our teams, and I know many of them are out there, have been building the new technology that you all will be using come November 9th when we launch. And we are optimistic, we are excited, we'll have a command center, we'll be working with you to bring up this new product, and we are really pleased with all the features that are gonna play out in this next version.
Marguerite Salazar, I think everyone's aware of how you have been dealing with the question of cost in the last year or so. And that, of course, is frequently the barrier to somebody having health insurance. Where do you feel we are with that, getting people to understand the costs and sign up?
All right. Well, Cynthia, this is a very complex question. In fact, when you look at the word Affordable Care Act, the whole idea was that we were going to try to make healthcare more affordable. And so as we went down the path of trying to create these health plans that would fit all the new laws and all the regulations that went with the Affordable Care Act, what we came upon were a lot of nuances that we hadn't thought about. When we first approved all of the plans last year, and I'd like to point out that the Division of Insurance does not actually set premium rates. What we do is we approve the rate range that insurance companies present to us. And they come to us and say, we can do this with these plans, and it's going to cost this much. Our job is to make sure that the rates are not excessive, but at the same time that they're not too low, because we cannot have these insurance companies going broke. And so it's a really important piece to understand of how insurance companies actually are able to pay those rates based on, or pay the fees based on what they charge. So what happens was, rates are sent out now without the ability for any of the carriers to use pre-existing conditions and health status. There's not a lot that the plans have in ways to be able to save money. So the only things they can look at is whether you're a smoker, where you live, and your age. And then, of course, the kind of plan that you decide ultimately to pick. Well, in Colorado, what happened was that we're a very geographically diverse state. And so a lot of, we set up 11 different geographic rating areas. And some of you may have heard a lot about the resort areas. That's the areas in Glenwood Springs, it's Pitkin County, Eagles, Summit, and right in the resort areas where all the ski folks live. Well, it turns out that cost of healthcare in those areas is much more expensive. And so, as a result, the premiums are much higher. Along comes transparency, that's part of the Affordable Care Act, and people in those areas start looking at the differences in the healthcare costs. And you probably got a lot of this, I'm sure. Well, it turns out that a plan that you could buy in Denver, the exact same plan costs 50% more in certain areas of the state, primarily the resort areas. So what we did last year, because we didn't want that to keep people out, the whole idea was to make it more affordable. And I'm sure that as you were going through the plans with people, when you find somebody, typically an older patient or a person, 55 and over looking for a plan, the cost was sometimes prohibitive. So what we did at the division was to do a study to find out where those differences are and what could we do different. So what we did in the end was we combined those geographic rating areas to take some of the lower cost into the higher cost and see what would happen with that. And as a result, we were able to see the rates actually go down, and they went down significantly. So I think part of my message to you is that we're going to keep tweaking and looking at why the costs are what they are. We are also really, I think, fortunate to see that carriers were able to go back and negotiate better rates with providers, because that's really where the rubber meets the road. That's where the costs, can be controlled, not with the division, and really the premiums can be controlled when the costs go down. So we had several carriers that were able to go and talk with providers and negotiate lower rates. As a result, you're going to be able to sell those plans, some better plans with lower rates, to people in the higher cost areas.
So, as more people have been enrolled, how good a job has been done in getting some of those reluctant ones to see the value of having insurance, for instance, the younger ones, and also what are you finding about the new enrollees in terms of how sick they are?
So, Cynthia, it's a great question, and because of
it's actually two, I'm sorry.
Two questions. Because of all of these folks out here, we have done an amazing job, you all have, with informing people and helping them understand. What we do know, though, is that the folks that are coming on to Medicaid side are not coming on as sick as we thought. And so that is great for our state. They aren't staying as long as we thought either. And that is not so great unless we have alignment between the private sector, the private commercial plans, and between public programs. And so one of the things that I beg all of you to think about is to try to help people understand this concept of churn and this notion that as they have to report their income, they could be moving from a private plan to a public plan. And they have a duty now to really better understand how to report their changes and be part of that selection. And I think we'll see more and more commercial products want to be in the Medicaid space as well, so that they can have a consistent primary care medical home, whether it's on the private side or the public side. And it's one of the pieces that I hope, as you all serve as really the interpreters and helping people with this knowledge, is just trying to get them to understand that having a continuous medical, primary care medical home is so important. And I think the coverage piece is going to continue to evolve in our state. But we clearly are seeing some great value propositions on the other side. I mean, really some great pricing. And we also are seeing people get it, this movement between kind of their public Medicaid plan and then switching over to the private side and then hopefully minimizing their time back on Medicaid.
And Cynthia, if I could jump in, you mentioned the word value. I know all of you out in the audience understand the value of insurance, and I have a feeling that's one of the hardest things to convey to the folks that you're working with. And what I would say is, while we have limited the number of choices of plans and the variation of criteria so that it becomes a simpler decision, the reality is value is still personalized where price is not. And so to Marguerite's point, the more we can all help people understand the value of what they're buying and how to use insurance, and that's where, again, where you come in. The education is everything around this. So I want to say personally thank you on behalf of Connect for Health for all you are doing to help us all get covered in this state and focus on value. That's what will bring the cost down ultimately in the long run, and to have people get what they need.
Well, let's continue on the cost and the price and so forth, because automatic renewals are something that enable consumers to stay covered and not worry about running out. But this could also cause their out-of-pocket costs to increase, because lower premium prices may mean lower tax credits. So how are you planning to raise awareness of consumers on this, Gary?
So this is maybe one of those unintended consequences of a complex system going up very fast. The reality is the tax credits are based on the second lowest silver plan price, as you know. But if your plan price that you're shopping for this next year goes up, the irony here is the tax credit could have actually gone down if that silver plan price went down. And so again, I just emphasize the role of education, of helping people understand the role of insurance, what you're shopping for, and most importantly, what your family dynamics are that you're working with. I mean, I can't tell you how many test cases we are running through our systems right now for every possible variation of families, and I think the number is somewhere close to infinite. And so...
does that include the pets? Or?
No, pets are not included. Definitely not included. But again, the concept of value rises to the surface here, and I think it's going to take quite a while to help people really understand the value of insurance. I know when I first shopped for it years ago, I didn't understand all the variations of it and how it intersected with providers and the like. And so there's an infinite amount of options, even though there's very few on the website. There's still the variables of family matter.
And Marguerite, let's see. Let me ask you to continue on this as well.
Thank you, Cynthia. You know, we almost here in Colorado have an embarrassment of riches because we have over 1,000 plans that the DOI approved this year. And when I look around at our neighboring states and I see that places like North Dakota, South Dakota, New Mexico maybe only have a handful of plans, it's really a bounty that I think we should be really grateful for. However, at the same time, because we have so many choices, again, I know your work is really cut out for you. But if people will just remember to check, to shop, to make sure that, you know, the plan that you are, that maybe you've encouraged someone to buy or they've chosen through your help, if that's not working for them, if the price did go up, because again, when we talk about the rates going up an average of 1.5%, this is an average. Some of them went down by 20%, and some of them went up by about that much as well. So people really have to look and see what it is they're buying and what's out there for them. The advanced premium tax credit, that's something that is so important, and while it will probably go down as a result of rates actually going down, it's a good thing, but some people may see that as a bad thing, but the rates have actually dropped, and so that's why the APTC went down. Please just help people look for the plan that's going to fit them, to make sure that their providers, the hospital that they want to go to is available on that plan, because again, network adequacy is something that the division is really working closely on. If you have questions about which providers are on which plan, please let us know, because I know we're still working out those nuances and trying to make sure we get that data out there. So lots of stuff, lots of moving parts, we know that, but I want to just assure you that we've evaluated all of those plans, we've looked at their networks, we're looking at everything that they do, so what you're selling has a lot of value, and again, we're so lucky to be in a state that has this kind of bounty and the ability to offer so many choices to our citizens.
And Sue, will you talk about peak a little bit?
You bet. So I actually think Patrick Kelly is out there in the audience, and Patrick should probably raise his hand. He was a leader down in Boulder. He's right over here, but Boulder County Human Services, their team put together a great concept 4 years ago, and I believe the Health Foundation early on said, you know, this is kind of interesting. And what we did in partnership, public and private, was really build an amazing new way for people to access the system. So PEAK is Colorado Medicaid's door, if you will. It's another door that is opened for people to access the system. They obviously can come in through Connect for Health, which is fabulous as well. PEAK is another way, but we've built a shared eligibility system that you will be debuting here on November 9th. And it's winning awards because 80% of the time right now, people can go in, and what used to take us 45 days now takes us 45 minutes. So if people have all their information, they can get a real-time eligibility. And I see lots of hands clapping. Let's give it up for that team. The other thing I just want to let you know is that people can go in and report their changes on PEAK. So it means they don't even have to go and see their county human services worker. They don't have to kind of go rely on somebody. And I like to tell people, as a nurse, this is the first big shift that I think we're going to see into what I call new consumerism. People taking more responsibility or having more direct access for their own kind of reporting and their own life. So I really am pleased with this new tool that our teams have created, this PEAK tool. There'll be a hand application that's available too, coming online. Right now they can go through the internet, but we're really pleased with PEAK, and I know other states are already starting to look at our platform and borrowing it, and I do believe Colorado in November will claim the nation's best eligibility system. So that's really exciting stuff, and I think you all will be really pleased. And if you're not, we want your feedback, because we can tweak things as we go along, because, I mean, we all know with technology, these applications can change and morph and be refreshed. And so we know it'll be really, we're confident, because our testers have been so pleased with it. But we do need your feedback as we go through this process together, and we will have a command center that is open as we launch, just like last time, and so we'll have a lot of rapid response and working together.
Contrasted with the first open enrollment period last year, what are you anticipating will be the challenges a month from now when that starts? Gary, you want to start?
I would love to. You know, one of the biggest challenges is, as you all know, our open enrollment period has gone from 6 months down to 3. So we now have not only all the folks that signed up last year, and hopefully every one of them renews, but we're also signing up new folks, and with our goal to obviously get all Coloradans covered. And so I think that's one of the challenges is squeezing all of that activity into a short period of time. That said, to what Sue just referred to, there are many, many new tools that will make this go smoother this year. We have everything from a formulary tool that will help folks, families, everything figure out whether their network is included in the plan, as well as their medications. The provider tool will also help with that, as I just mentioned. And perhaps alluding to what I was just commenting on, the complex family calculator that we've developed is a handy-dandy tool to help you figure out who you're really working with and who's eligible. For the small businesses, we also have a quick quote tool coming up that will be only require 6 inputs to generate a premium. And so that is in direct response to the feedback that you all gave us this past year. And on top of that, we have an avatar who is named Kyla, after somebody in our office. She's a rock star, and now she's going to be on screen for you. And we're stopping short of developing action figures for it, but please look for it. Her on our website coming in next month.
What's her name again?
Kyla.
Kyla. All right, that's very nice. It goes well with Siri, I guess.
Oh, no, she's much better than Sarah.
What are some of the other things that you're thinking about as this enrollment period starts? Sue, I mean, obviously, when I say in contrast to the first one, there are big contrasts just because it was so brand new last year. But are there other, I mean, the technology sounds wonderful. Is there anything beyond that that you're especially looking forward to or hoping will work? Or hoping won't happen even? Something else?
So, you know, I think you always get better as you go through the second round, and building off of what we did the first time, I think it requires all of us to have really tight communications, and I mean that. We have check-ins with some of our favorite lawyers out there. I know George was out there. So we have a team through our legal community. We have aging teams that report into us. We have county teams, and so the communications piece is really going to be critical. You know, the Medicaid side of the house has to find 87,600 new folks in this next enrollment period, and that's a lot of people to get in. And so the more you can start showing people how to be self-responsible and reporting their changes, little things like address changes or family household composition, that's really going to help us. And so I think, you know, what's not going to change is how our entities work together. This is a tight team. We have Department of Human Services as another partner. Reggie couldn't be here today. But Office of Information Technology, and we can adjust and be nimble and pull together. I challenge this state. We should get to 90% of our unenrolled folks that are out there. So it used to be about 800,000. We should come through this period, and I bet Annie might be willing to throw us a heck of a party if we could get done with this next enrollment period and we found 720,000 Coloradans. That'd be pretty amazing. And right now, we actually have grown a bit since the first enrollment period. We're actually at around 411,000 folks enrolled because people have continued to enroll after the first enrollment period. So we can do this, Colorado, 720,000 people. We can, it took Massachusetts 5 years. We can get this work done in 2 if we really lean in. And I see people going, yes, we can do this. We can do it. So.
That's only 300,000 more.
It's only 300,000 more to go. We can do this. You know?
We just need to divide the number of days, right?
And people.
It's all you got. Marguerite, last thought from you. Is there more in your office that needs to be done in this next enrollment period? Do you feel you have some things in place that will work?
Well, Cynthia, I think as with any huge policy change such as this one, you start to uncover other issues as you get into it. So we're working on issues such as the Tier 4, the very expensive drugs, and how do we help patients be able to afford those? How do we help insurance carriers put a plan together that doesn't bankrupt them, but also doesn't bankrupt the patient either? And so we're working on that kind of thing. Network adequacy is also huge. And I just want people to remember that there are a lot of options out there, that not to believe a lot of the rhetoric that you may hear about all the problems, that things are falling apart, because we really have come a long way. We need to continue this march forward, and it's brand new territory. You know, I always remind people that nobody's ever done this before. So it's really hard to be perfect out of the gate. But with all of us working together, with us trying to get those policies in place, and if they don't work, let us know so we can change those things that we can change, and we'll get there. You know, I really believe that another year, maybe year and a half, you know, it's happening. We all have stories. We've all heard the stories of the friend who couldn't get insurance because of a pre-existing condition, or the person who waited too long, and by the time he or she got to the doctor was way too sick, and as a result didn't make it. Those days should be over at this point, and that's what drives us every day. That's what makes me excited to come to work every day, and thank you all for being here. I really appreciate that.
Annie, if you'll give us a final thought. Thank you to the Colorado Health Foundation for bringing everyone together here, and what are your thoughts about access?
Well, I would close too with a goal of, if we can get to 90% by the end of this enrollment period, I guarantee you we will throw a really, really great party. And I wish you all lots of success. Maybe you'll find some of my long-lost relatives out there as you go, who knows? But thank you again for all you do, and making people really have what is a right in this country, and that's access to health care. So thank you.
Thank you, Gary. Did you have another comment?
I would just like to echo what Annie said and say a huge thank you to the Colorado Health Foundation. I know I'm a little biased. I learned a lot from this lady, and I wouldn't be here without what she's taught me, but what I'm learning now is that it really is all about relationship and what you develop with the folks that you work with, and momentum. And we have momentum right now, to what Marguerite and Sue were just saying. We don't want to lose that, and it's really in your hands to help us do that. We're providing a great tool to work with, and we're excited to launch it next month. But we also want your feedback to make it even better, and we will get to that 90%. Thank you.
All right, then I guess the last thing to say is go team.
Yeah, go team.
90%. Thank you all very much.
Thank you.